Thank you very much for this opportunity to speak about our project this morning. My name is Dr. Glykeria Martou. I'm a member of the Plastic Surgery and Surgical Oncology divisions here at Kingston Health Sciences Center. I've been here since 2016, involved in the establishment of the breast reconstruction program, which is the focus of my elective practice.
I'm Susan Brogly. I'm an associate professor and PhD epidemiologist in the Department of Surgery and co-investigator on Dr. Martou's grant.
Breast cancer in general is imposing a very heavy burden on patients and healthcare resources. Breast reconstruction is an integral part of breast cancer care, and in fact is a quality indicator for breast cancer care. How it's offered in an institution makes a big difference for how we're treating breast cancer patients. And the most important outcome of breast reconstruction is the impact it has on quality of life for patients. And we have a great tool available to us to measure that. It's called the BreastQ, and it was developed by a Canadian surgeon and her team back in 2009. And the BreastQ is available to measure quality of life for all breast surgery patients, breast cancer patients with or without reconstruction, as well as for other types of breast surgery. So there's important information that comes from using this tool to measure data on quality of life. And therefore, our project, the main goals are to measure this impact using the BreastQ for patients breast cancer patients who undergo reconstruction, as well as those who do not, and also measure how it's affected by the risk of complications with or without reconstruction. So there's a couple of goals for this project, because there can be significant variation in the delivery of breast reconstruction from center to center and community to community. It's important that we collect this data for our own institution so that we can counsel our patients, educate our colleagues and our teams, and of course create proper guidelines for resource allocation for breast reconstruction.
I think it will have an impact in two ways. The first, as Dr. Martou mentioned, we'll be collecting new data on health-related quality of life in women affected by breast cancer. So will it better inform patient choices and physician counseling on treatment? So in terms of the timing of reconstruction, what type of reconstruction, when to have reconstruction, perhaps at the time of the breast cancer surgery, perhaps later, in patients that are similar to the women themselves. So this will help to improve health-related quality of life, as well as patient satisfaction with the treatments that they're receiving. And I think, secondly, part of the innovation, not something we're doing yet as our cohort and our data need to mature and grow, but we have proposed to link these data with the administrative health data in Ontario that's held at ICS, which will allow us to look at patient contact with the healthcare system longer term, and potential complications, mental health diagnoses, and other things that have not been looked at longer term. While these data have been used, the BreastQ have been used in other studies, they haven't been linked in this way, nor used in a long-term prospective cohort study such as our LOSE cohort study.
We really believe in this project, and we are really excited about this opportunity that we're given with this fund. When our group looked at the BreastQ application in general, we found that it hasn't really been used in Canada the way it's designed to be used. Ideally, this tool should be used, from the moment of treatment and then moving forward prospectively, as Dr. Brogly mentioned. This really hasn't been done anywhere in Canada to our knowledge. So this is an opportunity for us to create a database and follow these patients prospectively over 5-10 years. And it's going to be the first time that we collect this data for no reconstruction breast cancer patients. And that data is very, very important when we counsel women on whether to consider reconstruction or not. It's a decision that can pose complications and issues, and they need to know what will happen if they don't versus if they do follow reconstruction. So we do believe that it will provide very unique information and really help the shared decision-making model in our community and our patients.
our gratitude and thanks to SEAMO and the reviewers for funding our proposal and supporting research on women's health.